So we're just going to start off with some movements of joints here. First we have the knee extension, which is happens on the parasagittal plane. So when the body's split into left and right uneven halves, happens on one of the sides. And it happens on the frontal axis. So this is a knee extension. We also have a knee flexation. Which is when the knee kind of comes to the back of the gluteus maximus here. Lateral spine flexation. It occurs on the frontal plane, so as if two pieces of glass are in front and behind you and you were trying to avoid breaking them. That's kind of where the left spine flexion occurs, and also happens in a sagittal, in the sagittal axis. We also have the shoulder, the glenohumeral joint, which happens on a transverse plane and is also, the axis is the sagittal axis. So we're going to start with the abduction for that. So I just have a free weight here with me just to kind of help my demonstration a bit more. So for the abduction we have just both the shoulder joints coming together, as you can see there. Then there you go. And just for the adduction, you have a starting position here with your shoulder kind of out laterally, or your shoulder joint kind of stimulated laterally out there, and then you'd be pulling that down and just bringing the shoulder back into the body towards the midline. Shoulder girdle joint ab and adduction, we have those occurring on the frontal plane, and they're on the sagittal axis. This is kind of difficult to demonstrate, but it'd be better if there was some a table or something to show you on with a weight. But basically, the shoulder girdle abduction is when you bring both arms together and you just bring them towards the midline almost, just like that. And the adduction would just be bringing the arms behind almost posteriorly and just getting those scapulae abducted. There we are. The last one we have is the hip joint. This happens on a transverse plane. Let's see, let me fix this. Happens on a transverse plane here. Because it's the top versus the bottom half, so transverse down here. And we also have that occurring on a longitudinal axis because we're rotating them inwardly and outwardly. So we have the medial rotation, which is going inward like that with the hip. And then we also have the lateral rotation, which is going outside to the hip and flexing that outward. Personally, remember tension or tense integrity is, I just kind of remember the push and pull, which is kind of like tension between the muscles and the fascia, which are attached to the skeleton and responsible for movement, which provide alignment, mobility, and stability for the human skeleton and the human body, both when in motion and sedentary.